At the end of medical training, Prakamya Singhal's first posting was to the intensive care ward. The 28-year-old found herself in the eye of India's COVID storm.
It was almost like a pile of dominoes just going down, because in that very shift we had at least 5 to 6 deaths, and it was something that I think that I wasn't really prepared for.
Far worse was to come as the new variant raced through the city. There simply weren't enough beds for the critically ill turning up at the hospitals.
You feel that no one should die because they did not get an ICU bed on time. I don't think that's a good enough reason.
And you were seeing that?
Yes. Still, even now, there are at least 4 to 5 patients in our wards who are in urgent need of ICU beds. It creates such a difficult situation for the doctors who have to make that difficult choice. No one wants to be in that position.
Working amongst those infected by the new variant, Prakamya and her colleagues at the Safdarjung Hospital noticed some worrying differences.
Now we have almost an equal proportion of people who are 60 or 70 years of age and people who are in the range of 20 to 35, 40 years of age as well. The youngest patient in my ward right now is a 15-year-old child.
The team has been shocked at how quickly the young patients become critically ill.
We're still struggling to see as to how quickly our patients are worsening. It almost leaves us with no window period to provide them with the right intervention at the right time, and it's just, I remember speaking to my other colleagues as well about the same patient, and everyone had the same opinion that, that patient, how did we lose him?
Do you think people are feeling failed, though? Do you feel in a way that you are let down?
Definitely. I mean, people, healthcare workers, I think everyone feels let down by the government. This is not what you should have been expecting your healthcare professionals to do, where they would need to walk into these wards of death, I would rather say.
But that is what Prakamya must do until this second wave has passed. Juliet Bremner, News at 10, Delhi.